Sunit Sebastian. He is an experienced academic radiologist with fellowship training in body imaging and emergency radiology at prestigious institution in the United States. Dr. Sebastian serves as the Chief of Radiology at Taub General Hospital and the Chief of Emergency Radiology and Associate Professor and Vice Chair of Innovation for Radiology at Baylor College of Medicine in Houston, Texas. He is the author of several papers in distinguished peer-reviewed journals and has been awarded multiple research grants from NIH and is the recipient of multiple Best Teacher of the Year award by his residents and medical students. Dr. Sebastian is also a successful entrepreneur and is the co-founder of multiple healthcare-related startups. He is an advisor to multiple artificial intelligence related startups in the US and Europe. In addition to being passionate about all things AI, Dr. Sebastian is equally impassioned about finding or cooking the perfect bowl of ramen and aspires to complete a 2-year ramen apprenticeship in Osaka, Japan, sometime in the next decade. So we are pleased to have you with us to enlighten us about the subject, May AI help you?
So good morning, everybody. Thank you for that very kind introduction. Can you hear me? You can hear me, right? Okay, very good. So again, good morning, and thank you very much for the very kind invitation to join you on such a joyous and momentous occasion. My congratulations to all of the toppers and all the students who have done extremely well and who are looking for such a bright career ahead of them. Special thanks to Dr. Sunit Sebastian for inviting me to speak with you today. He wanted me to speak a few words in Malayalam, but I think I will not do that just for everybody's sake. So let's dive in straight. The topic today is May I Help You? And it is basically related to a very important topic in radiology, which is going to be in the limelight in the years to come, that is artificial intelligence in radiology. So if you look at healthcare in general, we are seeing new market models that are being developed in the consumer space. Consumers, that is patients, want the cost of these studies to be as low as possible and to get quality information at the best possible price. Now, this has changed remarkably over the last few years, especially with the consumerization of healthcare. We all know that we all exist in a shared knowledge economy, which means that data can easily be transferred from one country, from one population to another country, another population, such that we can achieve results in quick time than ever before. This is a classic example. I'm sitting thousands of miles away from you and sharing with you what artificial intelligence is, and then you can develop your own thoughts about it, your own wisdom about it, and then do something about it tomorrow. So shared knowledge economy has completely changed the way we practice medicine in the 21st century. And the classic example for that is the development, the quick development of the COVID vaccine across the entire world in a space of 18 months when we were hit by the pandemic over the last 2 years. The other thing that we are seeing in healthcare is the foray of big tech into healthcare. Now, healthcare is particularly delicious for big technology companies. For example, Amazon recently had a joint healthcare venture forum called Haven that looked into the insurance space for healthcare. So big tech like Apple, the Googles, the Amazons have now demonstrated big interest in healthcare. For one reason is, there's a lot of data in healthcare, and two, there is big money involved in healthcare. So obviously these companies look at this as a new space where they can really, really make a dent in the day-to-day operations of healthcare. Now, everybody probably recognizes this slide. The first is a drop of oil, the second is a drop of water, and the third is a drop of data. And they say that data is the new water. In the 21st century, data is the most valuable commodity that is out there in the world. And we all know we use WhatsApp, Instagram, Facebook, Snapchat every day, and all that is data driven. And hence, in the 21st century, what really rules is data. Now, the one thing when we talk about artificial intelligence, the word big data gets thrown around quite a lot. And what is big data? Big data basically means large volumes of data that if you and I sat and started to read and try to understand, we would not be able to wrap our heads around it. Hence, we develop computer algorithms to analyze this big data or this large volumes of data, which then can be used to form trends and patterns of populations. So this is used across the board, not only in healthcare, it is used in every other industry, from consumerism to selling cars to selling books online. Big data is the basis of artificial intelligence going forward. A case in point, Google is using about 46 billion data points to predict the medical outcomes of hospital patients. So somebody like Google, who has a very, very, or actually captures the market space for search engines, can actually analyze 46 billion data points to predict medical outcomes, things that normal human beings do not have the capacity to do without the presence of artificial intelligence. Now, a couple of things in radiology. I did my radiology residency in 1997 and finished in 2000, so almost 21 years ago. That now dates me quite a bit. But some of the things that I'm really, really excited about radiology is the presence or the increasing presence of virtual reality in radiology. And what is virtual reality? Virtual reality is the use of artificial computer generated simulation or recreation of a real life environment or situation. But the one that really has taken mainstream is augmented reality, where what we do is we use a technology, a special technology that layers computer generated enhancements atop an existing reality in order to make it more meaningful through the ability to interact with it. So both virtual reality and augmented reality actually have come in from the gaming space. If you are a video game enthusiast like my son, I don't know how to play video games to save anybody's life, but if you're this modern kid who plays video games, then I think you would be more attuned to virtual reality and augmented reality than I am. Where I'm really interested in augmented reality is its use in healthcare. It's been used in a very big way in simulation, anatomy dissection, surgery, virtual surgery, radiology. And one of the equipments that we use is called as a HoloLens 2. Now this is a Microsoft product. I think this costs somewhere around $4,000, $5,000. Don't quote me on it. I do not represent the company. But what HoloLens 2 does is that it layers a technology or a virtual reality on an existing reality, and thereby we are able to interact with that environment. So if you visualize a radiologist sitting in a dark room in front of a computer monitor and reading CT scans, MRI scans, X-rays, ultrasounds day in and day out, I think this, what you're about to see in this video clip, is really, really going to change your idea about what the future of radiology is going to look like. So look at this. This is Tyler with an update on the... I'm going to just play this again for you. Let's see whether this plays right. So what's really, really happening is this guy's wearing his HoloLens, and an image data set has been now uploaded, and he can visualize this CT scan in a three-dimensional space in his living room. So he doesn't have to sit in front of a computer monitor. These are loaded through the HoloLens. You can see when he's moving, that image is blocked by the pillar such that that is identified as a real object. He can scroll through these images. He can change the window settings of these images. And it's a very, very cool thing. We actually have this in our department, and it's a really fun thing to play with and to use. It has got a lot of applications in radiology, especially if you're in a field where you have CT scans just uploaded to you. You don't have to be near a physical workstation in order to give your diagnosis. So very very excited about the HoloLens. Very excited about virtual reality and what it can do in the future. I think it completely changes radiology from a two-dimensional experience. We do 3D imaging in radiology all the time, but the experience is two-dimensional. I'm just sitting in front of a computer. This actually takes that experience and converts it into space and volume and time in real time. So you could read these images anywhere in your living room or outside in the ground as long as you're connected via the HoloLens. Very interesting. So now let's address the elephant in the room, and that is artificial intelligence. And Dr. Nitin was saying that a part of this talk has to address your apprehensions, your doubts about the field of radiology in the future, and what artificial intelligence is really, really going to do to radiology. Is it going to completely kill radiology in the future, or is it going to enhance radiology in the future? Is something that I want to touch upon in the next 15 minutes. So let's address the elephant in the room, and the elephant in the room is artificial intelligence, also called as AI. Now, many of you would probably recognize this picture, and it's actually a textile mill. It's still a hand weaving mill, but it uses a machine to actually make cloth. This, if you believe me, this is the first example of artificial intelligence known to mankind. And you would wonder, why is this artificial intelligence? Because before this, cloth was made completely by hand. And when this machine was introduced, the ability to make cloth increased by 10x. That means you could make cloth 10 times faster than you could make it by your own two hands. Now, not surprisingly, when this machine was introduced in the market back then in the 1800s, there was a lot of resistance from people, especially when it was introduced in England. There was a group of people who actually burnt down these machines, saying that these machines are going to take away their jobs and that very soon they would all be jobless and would not have any money. But I think when we read history and we read literature, the reason why these people were apprehensive was they did not know what this technology would actually do in their lives. The change that would bring about in their lives almost brought in an industrial revolution for the manufacturing of cloth, and therein started the entire textile industry. So if somebody asks you artificial intelligence is so cool, is so hip, is so 21st century, actually you can just tell them, well, the first textile mills that were operated by hand were the first examples for artificial intelligence. So whenever there is some new technology that is on the horizon, it always gets embraced with a little bit of skepticism, a little bit of doubt, fear, and I think these are all normal reactions of human beings because we as human beings fear the unknown. But once the technology becomes clearer and we know how to adapt it to our lives, then we see the value that these technologies bring to us going forward. So some of the lingo that is thrown about when we talk about artificial intelligence is artificial intelligence itself, machine learning, deep learning, and artificial neural networks. So what is all this? So basically, they're all interconnected. Deep learning leads to machine learning, and then that machine learning leads to artificial intelligence. And so artificial intelligence is basically a computer algorithm or a programming system that usually performs tasks that require human intelligence. So the computer is taught a series of programs and algorithms, and then what it does is then it can start thinking just like a human being. Remember, start thinking and start processing just like a human being, but at much, much faster speeds and using much, much larger data sets compared to what we are able to analyze in our brains. Deep learning and machine learning are the ways by which this artificial intelligence is achieved. Don't want to go very deep into this, but These are the three terms that you would need to know when you're talking about artificial intelligence. So, what is all this noise about artificial intelligence? So, for radiology, I think the problems, or actually the controversy, started when you started getting these sensational articles in literature, like the one that was published by Stanford, which says AI versus doctors. The Stanford algorithm can diagnose pneumonia better than any radiologist. Big claims, right? They're saying that, okay, we are now going to replace radiologists with computers and they are going to read these studies. And this was like 8 or 9 or 10 years ago. Another very popular magazine in America is called The New Yorker, and they said, the algorithm will see you now. You don't need a doctor. The algorithm is going to see you. You'll walk into a clinic and an algorithm will take place, and you will talk to the computer, and the computer will give you a diagnosis and write your medical prescription, and you'll go and get your medicines. Again, this was also 7 or 8 years ago. Another important article that came out in Annals of Internal Medicine said healthcare in 2030, which is about only 9 years away, will artificial intelligence replace physicians? So, very, or another one in the New Yorker, artificial intelligence versus the MD. So, sensational articles all claiming that, there is the end of radiology and radiology is going to be completely replaced by artificial intelligence. Let me tell you straight away, all these articles were proven wrong, and nobody was proven more wrong than this gentleman here called Jeffrey Hinton, who said that if you're planning to work as a radiologist, you are like this coyote in the cartoon that you see here, who is actually on the edge of the cliff and who hasn't looked down yet. There is nothing underneath, and all he can do is fall into this deep pit. And it is completely obvious that in 5 years, deep learning is going to do better than radiologists. So this was 2016. It is 5 years already. We are in 2021. All right. Nothing of that sort has happened. I don't think I am this coyote who is falling down a cliff. I have great job security and enjoy being a radiologist. And AI algorithms are nowhere near to reading CT scans and MRI scans. And I've worked personally with so many startups in Silicon Valley and in Europe, and we are far from replacement. If I would have a crystal ball, I would say we are not even 50 years close for replacement. Yes, there are some things that artificial intelligence does well, which are repetitive in nature and which can enhance a radiologist's day-to-day work. Yes, that is going to happen, but replacement is an overstatement and is more for sensationalism rather than reality. The other thing that artificial intelligence saw was that a lot of venture capitalists in Silicon Valley started throwing money at all these startups who claim to develop products of artificial intelligence with the promise that radiologists are soon going to be obsolete and going to be replaced by computers who are going to do all the reading of all these scans. Now, artificial intelligence is going to touch healthcare completely. There is no doubt about this. It is going to touch radiology in a big way. That is where artificial intelligence really began in healthcare, because radiology is so technologically heavily oriented. But it is also going to come into critical care, ophthalmology, dermatology, cardiology, pathology, all these specialties, these subspecialties in the next 10 years and beyond are going to be touched and changed and enhanced by artificial intelligence in some way or the other. But radiology has been at the forefront of this change because, for obvious reasons, artificial intelligence in healthcare started with radiology, and most of the progress, most of the advancements have been made in radiology than compared to other fields. Now, one of the things that I'm working on with artificial intelligence and something that I'm very, very interested is a smart radiology work list. So we're not talking about replacement now, that somebody, a computer algorithm is going to sit and read my scans. We're talking about a computer algorithm that can modify a work list. Now, just imagine you're an emergency radiologist like me. I start reading at 7 a.m. in the morning. And when I come, I have about 30 or 40 studies on my work list. And I start reading the work list based upon the timestamp. So what was done at 7 a.m., I'll read first compared to what is done at 7:10 a.m., 7:15 a.m., 8 a.m., and so on and so forth. I think this is a very old school way of reading studies that are in front of you, which we generally call as a list or the work list. What AI is really going to do is rearrange these studies in the work list such that emergent cases that need urgent care, will be bumped up onto the list, and those are the ones that you will read first. So let's dive a little more deeper into this. This is called as prioritization. So what it will do, what artificial intelligence will do, is it will go into my ER work list, and then it will assign those normal cases. It will open these cases on its own, and what it thinks as normal, it will push to the bottom of the list. And the ones that it thinks are abnormal and need urgent care and are emergent will be pushed to the top of the list. So what we call this phenomenon is load balancing, such that you get a mix of complex as well as less complex cases, and you're reading on a prioritized list rather than just reading according to the timestamp. So here's a case. We have a big list in front of us. There are about 40 cases on the list. The radiologist starts reading from the top, but the AI engine goes into this list and looks at this CT and sees, oh, there is free air in the abdomen, which is called pneumoperitoneum. This is an emergency situation. It's a critical call. The patient needs to be seen immediately and has to be taken to the OR immediately to find out why he has free air in his abdomen. What it does is it will notify the radiologist on the work list, and it will bump the study up onto the work list as a first study in the list and mark it as red. Now this has never happened before, and this is what I call a smart work list. And I think artificial intelligence will have a very big role in the formation of these lists. And I'm very excited to see this, especially in emergency radiology, where 5 or 10 minutes can be a question between life and death. So that's about artificial intelligence, which modifies work lists. And the other thing that it can do with work lists is that, suppose there is a radiologist A who's specialized in neuroradiology, radiologist B is specialized, let's say, in chest or thoracic radiology, and radiologist C is an emergency radiologist like me. What this list can also do is it can actually divide the list and the cases and provide them to separate physicians based on their expertise. Again, this is internal to the list. Nobody has to do anything from the outside. The algorithm is written in such a way that the cases get routed to that particular subspecialty radiologist on its own. The other thing that it can do is it can calculate the average time that a radiologist takes to read studies. So if you know that radiologist A is faster than radiologist B in reading chest radiographs, what this artificial intelligence algorithm can do is transfer these cases to radiologist A, who reads chest radiographs faster than his colleagues. Similarly, if somebody reads a brain MRI faster than their colleagues, though that particular radiologist can be fed with more MRIs of the brain because they're more efficient and more accurate than their other colleagues in the practice. So what does this all mean? I think it'll lead to the formation of several apps, probably on the App Store, something called Speed Read, Brain Read, Night Read, Shock Read. These are all just mock apps. They don't really exist. But I think eventually what will happen is it'll lead to further consumerization of radiology, but in a way that we are more used to, like at the Apple Store or in the Google Store. The other place where I'm really excited about artificial intelligence is cancer imaging. And what artificial intelligence can do is go into the CT scan and draw circles or draw contours around tumors, measure their sizes, and characterize them, correlate them with the DNA information that is available from pathology, and then monitor them over a period of time. Now, this is a very laborious task for a radiologist to do. I used to do this for almost 10 years before I switched on to emergency radiology. It's a very repetitive task, and it is very labor intensive. But what the AI engine does, it automatically maps out these areas for the radiologist, and hence the radiologist takes about 1/3 the time to read these studies and then maps out whether the tumor is growing or whether the tumor is shrinking, whether it is responding to chemotherapy or not. So very, very exciting to see artificial intelligence really make a difference in cancer imaging and quantify tumors rather than just measurements. It actually measures the volumes of these tumors, and thus we can say whether a particular tumor is responding to treatment or not. We can change the chemotherapy drugs if the tumor response is not optimal. So here we are at the touch point of technology and mankind, artificial intelligence and human intelligence somehow now have reached a point where the interface is much more seamless than it was before, and artificial intelligence is really, really going to change the way we do radiology. Now, all this is great, it's a presentation, but how do we think this is really going to happen in real life? So here is a small skit that I've prepared. There's a chest radiograph on the list. This is Dr. Tran, who's a close friend of mine. She's an emergency medicine attending. She wants a read on this chest radiograph. She's looking for me in the radiology room, but I'm busy doing something else. We have an AI reader, an artificial intelligence reader called Sherlock, who can assist if the radiologist is not available. And then we have an assistant who connects all these people as a virtual assistant. Her name is Sophia. So here's a radiograph, and Dr. Tran has some questions. George, if you can play the audio, let's see what happens when Dr. Tran wants a read for this radiograph. So let's see if we can play the audio.
X-ray read on Mr. Garcia. I tried to reach Dr. Sebastian, but it seems like he's in a procedure.
Hi, this is Sophia. I am your virtual AI assistant. I can help you with that. Would you like to speak with our AI reader, Sherlock?
Okay, can I speak with your AI reader?
Hi, this is Sherlock. I was told that you were looking for a read on the chest X-ray of Mr. Garcia. I can help you with that.
Thank you. I wanted to know if there's a pneumothorax on the chest X-ray of Mr. Garcia.
There is no pneumothorax on the chest X-ray, but it seems that the endotracheal tube is in the right mainstem bronchus.
Are you sure about that?
Well, I'm not very sure. Maybe we should consult Dr. Sebastian. Seems like he is back in the reading room.
Hi, Dr. Sebastian. I just wanted to confirm whether Mr. Garcia has a pneumothorax and what's the status of his ET tube.
Hi, Dr. Tran. Sorry, I was in a procedure. There is no pneumothorax on the chest radiograph of Garcia. However, his endotracheal tube is in the esophagus, as seen by a large amount of air in the hugely distended stomach on the frontal view. Thank you.
Thank you, Dr. Sebastian.
How would you rate our AI reader, Sherlock, out of 10?
I would give him a solid 4 out of 10.
So I hope you were able to hear it. It's a little tongue-in-cheek, but as you can see, the technology is not really completely mature enough to really provide a read that an experienced radiologist can give compared to an AI reader. Of course, the technology is getting better day by day. We have come a long way than what we were 5 years ago, and I've seen this journey myself, having interacted and being a mentor to most of these companies.
Recording in progress.
In Silicon Valley. But again, I think the value of the radiologist is undoubtedly important. What they bring to the table for their referring physicians is extremely important. And so artificial intelligence and artificial intelligence readers might help, will enhance the workflow and the productivity of a radiologist, but I think replacement is an absolute myth and is not going to happen in the near future. Bill Gates says we always overestimate the change that will occur in the next 2 years and will underestimate the change that will occur in the next 10. And so maybe I'm wrong, maybe underestimating what will happen with artificial intelligence and radiology in the next 10 years. But I think it would be safe to say that the technology has not reached a point where it can safely replace a radiologist and also gain the confidence of referring physicians, whether they'll trust somebody who speaks with a robotic voice or somebody who speaks like me, who they see on a day-to-day basis, interact with on a day-to-day basis, and know me at a personal level, both as a human being and as a radiologist. I think that replacement is going to be extremely difficult. So in summary, I want to say that I'm very, very highly optimistic about artificial intelligence. I don't think there is anything to worry about me losing my job or you losing your job or in the next 15 years after you've done all your training, whether you'll be replaced by a robot. I don't think so. What's really going to happen is there are going to be two classes of radiologists. One, that who use AI, and the others who don't use AI. And the ones who don't use artificial intelligence are the ones who are going to be left behind. The ones who do use will have higher productivities, will be able to analyze patterns and trends, and provide reports of higher quality and at a faster pace than their counterparts who do not use artificial intelligence. So I don't think the scenario is going to look like this, where we have a bunch of robots running around in the reading room and fighting with each other, and we'll have to play referee among them. I don't think this is the scenario, but the scenario that we have seen over the last year is one of triumph of the human condition. Such difficult times, the pandemic, we saw how the entire human race rallied with each other, for each other, and these pictures like these are that warm the heart, and pictures like these are ones that tell us that our value as physicians, our value as caregivers is much more important than anything else in the current world. So I don't envisage a picture like this where a bunch of CTs being read by somebody who looks like Ex Machina, the movie. But I envisage something like this, where we'll have huge screens instead of just monitors, where you'll have radiology information, pathology information, DNA, genetic information, geographical information, all in one. And so the reports are going to be very, very comprehensive, can be tracked over time, and diseases being detected very, very early before they metastasize to other organs, therapies that take genetic makeups into consideration, radiology reports that analyze multiple different points of data than just the images in front of them. So thank you very much again for having me. I hope this was useful. Again, congratulations to all the toppers. And the only thing that I say is choose your branch based upon your passion. It's not about what's hot in the market, whether you're going to have a job in 10 or 15 years. I think nobody can predict that far out in the future. And it hasn't been any more truer than the last 2 years when we saw the whole world turned upside down with the COVID pandemic. So choose wisely and choose what you're really, really interested in, what you're really, really passionate about. And I think you'll have an extremely bright future. So thank you very much. And I'm open to taking questions if you have any. So feel free to ask questions. Don't be shy. You can ask me in Malayalam. I understand Malayalam, although I'll reply back in English. So yeah, just feel free and don't worry. It's an open forum. We are all friends here.
Hello, sir. Sir, am I audible?
Yeah, I can hear you.
So, what about the future of interventional radiology?
If I hear the answer correct, what is the future of interventional radiology? Is that the question?
Yes, sir.
Yeah, so very bright future, right? Interventional radiology again is even more safer than diagnostic radiology, because I don't think you'll have robots performing interventional radiology procedures. Although in the United States now we are seeing some issues of turf, wherein vascular surgeons, neurosurgeons want to do more and more of interventional work. But again, I think it's a fabulous branch. I used to do quite a bit of non-vascular interventional radiology earlier in my career in the form of abdominal interventions. But I think if you're interested in actual interventional work, interaction with patients, And if you really like blood on your hands, then I think interventional radiology is a lot of fun and a great branch. And you can see, results immediately. Let's give an example. Your patient comes in and has a bleed in his abdomen, and you as an interventional radiologist can embolize one of those arteries that is bleeding, and within 20 minutes the patient is back to normal. So it can be very, very satisfying, can be challenging at times, but it's a very fun specialty, and has a great future ahead of it.
Thank you, sir.
Anyone else? And I'll give Dr. Nitin my email. If you have any questions, feel free to email me if you don't want to ask in front of a crowd. And hopefully we can connect again.
Okay, so thank you so much, Dr. Sunit Sebastian. It was a very wonderful session. So I hope നിങ്ങൾക്ക് എല്ലാവർക്കും ഈ സെഷൻ ലൈക്ക് ഒരു ന്യൂ ഇൻഫോർമേഷൻ ആയിരുന്നു എന്നുള്ളത്. ഒരു റേഡിയോളജി എന്നുള്ള സ്പെഷ്യാലിറ്റിയിൽ എന്തൊക്കെ പുതിയ കാര്യങ്ങളാണ് ഇനി വരാൻ പോകുന്നതിനെ പറ്റിയിട്ട് ഒരു ഐഡിയ നിങ്ങൾക്ക് ഇപ്പോൾ കിട്ടിയിട്ടുണ്ടാവും. ഓക്കെ, സോ we will move on to the next session. So thank you so much, Dr. Sunit Sebastian.
All right. Have fun and enjoy the rest of the day, and congratulations.